Welcome to our onboarding video. Here, we'll walk you through the steps to get started with sending your full archwork to Mahwah Dental using a workflow that combines the efficiency of an intraoral scanner with the accuracy of a properly prepared and verified traditional stone model. This technique will streamline your full arch restorative experience while significantly reducing the risk of remakes at both the prototype and final stages of the process. A full arch restoration that lasts the patient's lifetime starts with implant placement. While there are far too many nuances to discuss at length in this video, we want to highlight a few critical points that relate specifically to the Nobel Persera zirconia implant bridge. First, ensure the maximum span between implants is no further than 38 mm apart and required cantilever length is less than 1 pontic. Second, the divergence of the implants must be reduced to a maximum of 45 degrees. Angulated MUAs should be used as needed to compensate for severe angulation when this is not possible. We recommend using the multi-unit aligning instrument to identify the angulation of the most suitable multi-unit abutment. After the implants have been placed and the temporary bridge has been restored, we suggest taking clinical images including a high smile, lips at rest, a retracted smile, and full-face smile to assist in the prosthetic design. After implant integration has been confirmed, bring in the patient to capture all requisite prosthetic records for the prototype. This includes capturing the intraoral scans, taking physical impressions, and aligning with patient on the desired tooth and gingival shade. Start by taking intraoral scans of the converted denture in the patient's mouth, the opposing arch, and the bite with the denture in place. Then remove the converted denture and take a scan of the tissue on the restoring jaw. Next, take a PVS impression using multi-unit impression copings and fast-set impression material while the denture is removed. Also, be sure to align with the patient on shading for their teeth using a Vita shade guide and soft tissue using a Lucitone 199 or Ivoclar gingival solution shade guide. Once the master model has been poured and set, it will need to be confirmed for accuracy using a verification jig that has been luted in the patient's mouth. Do this by, first, fabricating a verification jig using the recently created master model. From there, segment the jig with a diamond cutting wheel and secure the resulting sections on the patient's implants using a unigrip driver. Once the jig segments have been seated on the implants, lute the jig back together with flowable composite and pick up the jig using a mirror tray impression. Next, check the luted verification jig in the impression tray on the master model. If it seats passively without any rocking or gaps, the original model is verified and acceptable. If there are issues with the fit, create a new master model using the impression containing the luted verification jig. This model is now confirmed for accuracy and acceptable to use as a near-perfect representation of the implants in the patient's mouth. Once all prosthetic records have been captured and verified, it's time to ship your case. As there are both physical and digital records, it is not possible to submit everything together. To ensure proper matching, be sure to reference the same case identifier in each element. We recommend sending your digital files via the DTX-Go portal so both the IO scans and clinical photographs can be sent at the same time. Quick reference guides are available to walk you through the process. Alternatively, you can establish a connection with Mahwah Dental to directly send your IO scan files from your scanner and email the clinical photographs to support@mahwahdental.com. To ship the physical components, pack the verified master model of the restoring arch, opposing arch, and segmented verification jig in impression tray with the completed arcs in a box and send to Mahwah Dental. Once we have received the entirety of your order, you will receive an email containing your design within 48 hours and the prototype within 2 weeks. Included in your case box will be the prototype made from Sprint Ray on X-Tough material and verified on your master model, prototype bridge screws for each implant, and all property that was shipped to us and can be reused next case. Once the bridge and screws have been sterilized, insert the prototype in the patient's mouth and check for a passive fit. If it doesn't seat correctly, make another master model from new impressions before sending the case back to us for a remake. If the prototype seats passively, use a 0.5 mm hex driver to torque each screw to 15 Newton-centimeters. Next, check the occlusion and adjust as needed. If it isn't possible to make the requisite adjustments chairside, take new IO scans and send to us with the requested adjustments. After the prototype has been worn for 2 to 4 weeks, check the patient's satisfaction and make further adjustments if required. Once the patient is happy with the restoration, it is time to take the prosthetic records for the final. Do this by taking an IO scan of the restoring arch with the prototype, the opposing arch, and the bite. If changes are needed to the gingival surface of the bridge, also take a scan of the restoring arch without the prototype. Send these scans to Mahwah Dental through DTX Go or directly from your IO scanner, referencing the same case identifier as was used with the prototype and any adjustments that need to be considered in the design. Within 48 hours of receipt, you will receive your design and your final Nobel Procera zirconia implant bridge along with authentic clinical screws will be delivered within 2 weeks. Sterilize the bridge prior to restoring, and for multi-unit abutments, torque to 15 Newton-centimeters using an OmniGrip mini driver. It is recommended to verify the seating using radiographic imaging. Your Nobel BioCare team is here to help you treat more patients better. If you have any questions, please feel free to contact your dedicated sales rep or email us via support@mahwahdental.com. Find out what Mahwah Dental can do for you.